Good afternoon, Paulson Racin. Let's begin the warm-up session. Tell me what you feel is your greatest skill as a nurse.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly makes them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating and am equally comfortable working alone.
What are the current trends in nursing?
Some of the current trends in nursing include telehealth and technology in healthcare, the use of telecommunication and information technology to provide healthcare services. In the field of education, graduate education and advanced practice are on the rise. There is a push toward encouraging nurses to pursue higher education and advanced credentials, such as master's degrees and advanced practice registered nurse roles. There is also a shift from hospital-based care to community-based care, as more patients prefer to receive care at home or in outpatient settings. Alongside, nurses are coming up with innovation and entrepreneurship, that is, nurses are opening their own healthcare businesses, developing new products or services, or working for non-traditional employers.
Your preparation time is over. Please start your OET speaking roleplay.
Good morning, Mihiraa. I can see that you're not feeling your best. I'm really sorry you're experiencing nausea. That must be quite uncomfortable for you. I'm here to check on you and see how we can help ease your symptoms. My name is Lewis Hedge, and I'll be looking after you today. Before we talk about managing the nausea, I'd like to assess how you're feeling. Could you tell me when the nausea started and how severe it feels right now?
Oh, Nurse Hedge, I've been feeling nauseous since last night, and it's just not getting better. I haven't been able to eat much, and I feel so weak. Every time I try to drink water, I feel like I might throw up. I think it's the medication. I don't know if I can continue with it.
I understand, Mihiraa. Nausea can be deeply uncomfortable and draining, but there are several gentle strategies to help ease it. First, if you're taking medications that may contribute to nausea, adjusting the timing, such as taking them with food or at bedtime, can sometimes lessen the discomfort. Your doctor may also recommend anti-nausea medication, which can provide relief when symptoms feel overwhelming. Eating small, frequent meals instead of large ones can prevent your stomach from becoming too full or too empty, both of which can trigger nausea. Sipping fluids slowly throughout the day, such as water, herbal teas, or electrolyte drinks, helps prevent dehydration, which can worsen nausea. Remember, you're not alone in this. Many people experience nausea, and with patience and the right approach, it can often be managed effectively.
All right. But nurse, I don't think I can keep taking this medication. It's making me miserable. Can we stop it?
Mihiraa, I hear you, and it sounds like you're really going through a tough time with this medication. It's completely understandable that you'd want to stop if it's making you feel miserable. Your comfort is really important to us. However, abruptly stopping this medication might not be the best approach right now. This particular medicine is working in a specific way to help you get better, and stopping it suddenly could potentially disrupt that process. Sometimes, it can even lead to the original symptoms returning or new challenges arising. I know it's hard when you're feeling unwell, but completing the full course of medication is often crucial for it to be most effective. It helps ensure that the underlying issue is fully addressed and can prevent it from coming back stronger or even becoming resistant to the treatment in the future. We want to make sure you have the best chance for a full recovery. Instead of stopping altogether, how about we explore some other options together? We could talk to the doctor about whether a lower dose might be possible, which could potentially lessen those unpleasant side effects you're experiencing. There might also be alternative medications available that could work just as well but be gentler on your system. Let's discuss this with the healthcare team so we can find a solution that helps you feel better both physically and overall. We're here to support you through this.
I suppose that makes sense. I don't want to get worse, but I just wish I didn't feel this sick.
That's completely understandable, Mihiraa. If the nausea continues despite these measures, we can review your prescription with the doctor to see if there's another cause. Sometimes, dietary changes or other underlying factors contribute to nausea, so we'll keep a close eye on that too. I want to make sure you're as comfortable as possible. Do you have any other concerns about your medication or your treatment?
Not really. I just don't know how long I'll have to feel like this.
I understand your situation, Mihiraa. The good news is that we're monitoring you closely, and nausea from medication is often temporary. We have different ways to manage it, and you're not alone in this. We're here to support you. Your care team is keeping a close watch, and if any changes need to be made, we'll do so promptly. Your loved ones can visit you anytime to keep your spirits up, and we'll make sure you're discharged as soon as it's safe and practical for you. Now, before we move forward, do I have your consent to check your vital signs and proceed with the assessment?
Yes, please. I just want to feel better soon.
That's what we're here for, Mihiraa. Let's get started, and we'll do everything we can to help you feel better.